Happens during an acupuncture treatment. So, first of all, you'd be taken into the room, and generally the practitioner will ask you what you're there for. So, why don't we do like an example of, let's say you've got a sore neck. So, they'll ask you what you're there for, how it happened, how long it's been around for, what do you need to do to make it feel better or worse, just kind of general questions to figure out what's going on. But then on top of that, they'll also take your pulse, they'll look at your tongue, and they'll ask a few kind of like broader general health and lifestyle questions, like how much sleep do you get, do you have any kind of bloating, diarrhea, constipation, anything like that. And the reason for that is because Chinese medicine tries to treat you as a whole person. So for example, if you do have a stiff neck, that might be constantly reoccurring because you're not getting enough sleep, or when you try to sleep, maybe the mind's still churning and you don't actually get to shut down and feel better. And by doing that, it actually gives you a better chance of not just treating the sore neck, but also potentially some of the underlying causes for that. So a classic example of that might be, I've got a sore neck because I don't particularly like my job too much. So we can use the needles to not just help the neck relax, but stimulate your body to actually feel more relaxed, go into a rest and digest state, and start to lower some of those stress hormones, so you're in a better position to deal with what's going on in your life. Then you won't just feel better in the neck, but you should feel better everywhere. So once that's done, the practitioner will then generally put you on the table. They might do a few more physical checks. Maybe they feel the stomach, they might get you to breathe, or just check a few kind of ranges of motion. Then they'll add the needles in. When the needles are added in, they'll stimulate them, and then they'll leave you to relax for a little while. Typically coming back in and out of the room to re-stimulate the needles and just check the pulse and ask you how you are feeling, like how's your mate complaint. Normally that whole kind of session can go anywhere from a half an hour to about 50 minutes. So I hope that answers your question.